Hi, Alex. So are you learning more about surgery?
You bet, Dr. Scalpel. I've been learning so much. I know all about the OR team and the steps of surgery. I think I'm ready to do an operation.
Okay. How about a little more teaching before we let you loose on the public? Thumbs, how do you feel about teaching today?
How about we look at some surgical instruments? Knowing your instruments is the key to a good operation. We need to know which ones are which and how to use them. Let's get started.
There are so many different instruments for each operation. How do you know you have the right instruments for the job?
Each surgeon usually has a card for each operation, listing all the instruments they will need.
Yes, my card is the best. I can't be operating with other people's instruments.
Remember, all the instruments are sterilized before every case, and each instrument is carefully counted. That's why the nurse usually scrubs before the surgeon. It can take a while to count all the instruments, especially on a big case. The counting is very important. We also count at the end of a case too. The last thing we want is to close someone up with a forceps inside of them.
But seriously, that would never happen to me. Okay, let's look at the different families of surgical instruments. Instruments can have lots of different names, but don't let that confuse you. Just focus on the general types for now. You've got your scalpels and your cautery. Those are for cutting things open. Then we have the retractors. Those are for holding things open. Don't forget your suckers and sponges. Those are for controlling bleeding.
You can also use cautery to deal with bleeding.
Very true. Next up is the forceps. Those are for holding tissue. And then your clamps. Those are for controlling blood vessels. Next, we have your sutures and stitches. And they can be on a needle or a reel. They're for sewing things up. Then there's your scissors. Those are for cutting, obviously. And your needle holders. Those are for...
Holding needles?
Yes! I'm glad to see you're keeping up, Alex. Lastly, you've got your ports and scopes. Those are for laparoscopic work. There is a lot of other special equipment we can use too, like staplers and harmonic scalpels, and robots, but let's stick to the basics for now. In addition to knowing about the different types of instruments, it's really important to know how to handle them.
All the instruments are laid out on a sterile table or a raised stand called a Mayo stand.
If I need an instrument, I'll ask politely for it. That's why the scrub nurse stands beside me, so we can hear each other.
So I'll never get to touch an instrument then?
Not necessarily. When you're a student, the scrub nurse will often know what's coming next better than you do. You may find she puts a pair of scissors in your hand before you know you need it. So try and keep on their good side and they'll save your behind every time. If you need something, ask the scrub nurse politely and remember, a little thanks goes a long way.
Keep an eye on how we pass instruments around. When I ask the scrub nurse for something, I just put my hand up. Usually, I don't even look up, as my eyes are glued to the operative field. I know the nurse will put the instrument firmly in my hand, ready to use.
Wow, neat. Is that all?
Just one more piece of advice. You have to be extra careful when you're working with sharp instruments. I mean scalpels, suture needles, and needles for injection. Anything with a point. If you're not careful, you could injure yourself, your team, or the patient. Take your time. Hold the scalpel at the middle of the handle. Make your needle safe before you pass it back. And put the safety tip back on the injection needles as soon as you're done injecting. Always stay sharp when you're passing these items so the rest of the team knows they're moving.
You guys give the best tips.
Of course we do. We're the A-team. It brings tears to my eyes, Thumbs. I've done such a good job training you. Now, Alex, what did you learn?
Let's see. Number 1. All the instruments are sterile and carefully counted. Number 2. Each of the families of instruments have a different purpose. Don't mix them up. Number 3. The instruments belong to the nurse, so say please and thank you and don't grab. Number 4, watch how instruments are passed between the team. And number 5, watch out for sharps.
Okay, that's enough for one day. Teaching makes me hungry. Anyone for a chai latte?